go full screen on people. And so I'd like to introduce our super guest speaker today. Ruby Tam is a board certified family medicine doctor and also a certified Perrin Technique practitioner. And she graduated from Des Moines University, an osteopathic school of medicine in 2009. And then she finished her residency in 2012. And then for 10 years, you practiced full spectrum medicine. And then during that time, you came across an MECFS patient, started learning about the disease. And then in 2023, you decided to go full-time on a volunteer clinic to help MECFS patients. That is wonderful. And at the same time, you started serving on the Scientific and Medical Advisory Board of ME Action, which is also great. So thank you for joining us today and giving us some of your wisdom, hard-earned wisdom in this field. And we've got a set of questions that people have asked. And then if there's anything, you want to lead off with before you start answering questions, that's great too. But take it away.
No, so thank you for having me. And I just want to thank you all for joining or tuning in later afterwards. I know this is a very difficult disease, and I appreciate your energy spending on hearing what I have to say. So that's all I have to say. I'm hoping to uh, uh, go ahead and just start answering questions. And these are a couple questions that are turned in, and at the end, when we are done with the questions, if you guys have other questions, please go ahead and let me know, and we can certainly try to answer more. Okay, so I'm going to answer these questions by chronological order. Based on how early they turn into to MECFS San Diego. So the first question is about how do you handle young adult not leaving dark basement room due to light sensitivity and severe fatigue? With PEM, the body is deconditioned due to inactivity, but they said they cannot do any exercise. Is this his unique situation? And he also has POTS, depression, and anxiety. So first of all, thank you for the question. It is really common. I think everyone who is tuning in can attest to that. And I have had treated patients who cannot get up from the basement to the living room because they have to walk up the stairs. And so I would not push who is tuning in can attest to that. And I have had treated patients who cannot get up from the basement to the living room because they have to walk up the stairs. And so I would not push for. Go ahead. Someone has something to say. No? Okay. So I wouldn't push right now to do more exercise, trying to get more active because their mitochondria, their energy battery just doesn't have enough energy to even walk a whole lot. So I would say that it will be good to just if they can do some medications, it will be good to at least calm down. And if you guys can mute yourself, and then if you have questions, just raise your hand or put it in the chat. We'll try to get to it because otherwise we cannot even hear what you are talking about. So I would say that the first thing is to understand your limit of activity and respect that, because when your body doesn't have enough energy, you cannot really try to push it more. You are just going to crash. So medications that are good for anti-inflammatory, such as low-dose naltrexone, D-ribose. Even a very gentle Perrin technique can help if you are not intolerant to touch. Sometimes some of the supplement, some people try neck, CoQ10, they helped, and other things. So there's a question later about medications and supplement. But no, those are not unique. But we needed to work with what they have and try to get them better. Okay. And then next question, a mother, as a mother caregiver of an adult child with ME, CFS, and multiple mental issues, I heard a lot of comments and advice from close friends and family, and they all say I'm enabling the disease. My adult child never pushed themselves to become independent even a little bit. They always uh, uh, avoid doing all difficult things, worrying about PEM. What does a mom do? Um, I think this is very common when people do not understand what chronic fatigue is. They feel like, yeah, you are just trying to game the society. You are just trying to get people to help you. You are lazy, or you have mental health, or whatever. So I feel like you know what you are doing, and you believe in your child, and we as a doctor needed to learn how to believe in you too and your child. So that is the most important thing, is that you need to believe in your child. And yes, they should not be pushing beyond their limit, because when you push beyond your limit and have the crash, your body is making more inflammation that causes even a more significant crash. So a lot of people, before they came to see me, they said that they were better, and then they were doing more things, and then slowly they get worse and worse. Like they keep dropping in the activity level. That is the reason for people worrying about pushing. So I hope that is clear. Okay, another question about functional capacity tests. Um, Functional capacity test not safe for ME patients for disability application when you are considering using them, because you haven't found a doctor knowledgeable yet to write notes for disability? Or can a doctor do a functional capacity test? So we in Minnesota have a very good disability lawyer, and one time I asked her through this Zoom meeting if a disability judge really are looking at these functional capacity tests. She said that no, it depends on the judge. So some judge would like certain information and others don't. So she doesn't think that you need to go ahead and do a functional capacity test just by default. So I don't usually do that, because it is not safe for people with ME. You will crash really bad. If it is your last resort, yes, then you do it. Now, the other question is, what are we going to do with these doctors who cannot write good notes? First of all, I will say that when you go to see a doctor to talk about your illness, they need to be those who understand and compassion. I know it's hard to find someone who understands, but at least they believe you. So if they believe you, if they ask you, hey, how are you feeling today? Because your days can be better or worse. So if you say you are better today, gives a very concrete example. I was bathing once every 2 weeks, and this week I have some good runs of days, so I bathe only once a week. And so you need to be more specific. Otherwise, those doctors are just writing that you are better, and the judge says, oh, they are better. They assume you continue to get better. They don't understand the disease. So you need to fill in the blanks. And most doctors don't know how to ask questions like, why are you taking a bath once a week? So you will need to explain to them, or you need to fill in the information that the reason I cannot take a shower every day or bath every day is because of my fast heart rate. I get dizzy, I get warm, and it takes me 5 hours to lay in bed to get better after that. So you need to fill those information in so the doctors can put the notes into, put the words into the notes. The other thing about filling out disability paperwork, there's really no science to it. I believe my patient, and I believe that if I write a true story about my patient, the judge will hear it and will see it. So my goal when I answer any paperwork these lawyers gave me, I will say that I will put it as like I'm trying to write a story to show people why my patient cannot do certain things. Like why cannot make food. I will write that if they stand for 5 minutes to put the dishes away, they are going to lay down for 5 hours, something like that. Or if they go shopping, they will get so dizzy, they get short of breath, they need to sit multiple times. So those are the concrete example that needs to go onto this disability paperwork. So when you are asking the doctor to fill it out, of course, no one wants to fill that out because it takes a long time. But I wanted you to also tell them that please just write more example. And the only way they know the example is you give it to them when you are seeing them. Why can't you make food? And you explain to them, okay? So that is very important. So every doctor should know how to do it. Unfortunately, in my medical school, I never trained to do functional capacity tests. So I imagine the PA, the MP, the MD and DO do not know how to do it. So it will be more of a PTOT job. So, okay. All right, another question. Is it any possible way to reduce the lactic acid buildup that has been found in two important regions of the brain? Yes. In fact, there are methods to reduce the lactic acid buildup. Of course, you need to drink more fluid. But a lot of times, there is the lymphatic backup because dysautonomia, which is your nervous system, is controlling the drainage of the blood vessels and the drainage of your lymphatic. And we now found lymphatic in the head too. In the brain, they are called lymphatic because they are maintained by glia cell in the brain. So you don't need to know the term. You just know that there is another drainage system in your body called lymphatic, and that leads to the lymph node of your neck, and they all drain down here. So yes, drinking water helps, but then when the control system of the lymphatic is not controlling properly, that's when the pumping function of the blood to your brain has problem, and that's why you have POTS. That's why you have the lymph node enlarged and the lactic acid build up, your legs are swollen because the lymphatic cannot drain this fluid away. So a very gentle touch to sweep those fluid towards your heart is very important. The harder part is to figure out how much to do it, how long to do it, and how much pressure to use so you don't crash. Okay, so yes, that is possible. All right, I hope you guys are hanging in there. Another question. Is there a big sudden drop-off in potential recovery? A timeline, cutoff point, say 3 or 5 or 10 years, after which very severe ME fully backbound are far less likely to improve? No, I do not see that. In fact, one of my patients, whom I think she will graduate from ME this year, she was bedbound when I first knew her. I was in family practice at that time. I think we were doing medication at that time. That's the only thing I knew. She said I got her from bedbound to housebound. And then now she sees me for Perrin Technique, and she also does PT for her EDS. And so she's actually a lot better. In January, she was able to walk in the airport without a wheelchair. She has a little setback because of diverticulitis, and she will have surgery soon, so it might set her back a little bit. But I think we both are very confident that she will bounce back. And she bounced back very quickly from the infection, actually. And I think she will bounce back, and I still hope that she will graduate with the class, my first class of graduate at the end of this year, early next year. So, yes. And I have seen people who have very short duration of disease and they are not getting better. Some are very long disease and they are getting better. Some are severe, they're getting better. So a whole range of reason. So I will tell you that the duration is not what makes you getting better easier or not. It is how many comorbid conditions are going on, meaning that mental health, emotional stress is a big one. So if you had a trauma history and those emotions were not dealt with adequately. Now, adequately is a questionable word because you can never deal with your emotions enough. But if you have less of those emotional stress, it makes you crash less likely. And so that helps putting your all your rheumatological illness in perspective. Some people develop new rheumatoid arthritis, new different kind of immunos, different overactive disease. Figuring those out is important. Figuring out your diet is important. A lot of people have an undiagnosed mast cell activation or undiagnosed sensitivity to something. So we need to control that. So the idea that you can get better is when we identify all the reasons that can cause inflammation. And then we can put them under good control and making sure that your house doesn't have mold or whatever other thing, your water is clean, doesn't have whatever other metal in it, those type of things, etc. Then I think people tend to get better. Okay. All right, a question about medication and supplement. What are the most helpful for disabling fatigue? So I will say that for medications, I see that naltrexone has the best chance of getting people better. I would say about 75% of my patients do get somewhat better on it. It would be something you have to take for life. And also if you have to stop it, your symptoms will come back because it's like it's suppressing your inflammation. So when you don't suppress it anymore, you will have the inflammation, your body will crash again. And what worse is you were already doing better with the medication, so you feel like, hey, I can do a lot more. And then you were doing more than you're used to, and now suddenly without the medicine you crash really bad because you cannot really sustain those activity without the medication. So some people will notice that they crash really bad. But the problem is that not everyone tolerates it. Some people have severe headaches, severe fatigue from it, abdominal issues, so they just couldn't be on the teeniest dose. So that's unfortunate. Usually in those cases, I suggest people trying D-ribose, which is a supplement, a little bit more easier to tolerate than naltrexone. D-ribose is a molecule that our body uses to make DNA, as well as ATP, which is for energy. And so those two are usually the best bets I have for patients. Beyond that, it's like a hit and miss. I have some patients, they found that magnesium really help. Some people say, nope, it doesn't do anything. Some people find NAC helps. Others said no. Some people say they like B vitamins or CoQ10 or nectokinase. everyone has their own story, so I haven't found a consistency in all these stories. And the main reason is because everybody reacts to inflammation differently. Your body will have a different reaction pathway than others. And everybody has their own unique cause of the inflammation. So that's why all of these needs to be put together in an individualized way to see it. Okay? Now, next question is a hard questions to answer. What might be helpful at the onset of a crash besides rest? Unfortunately, nothing. So I wish I could tell you that, yes, take this drug and you'll be fine. I honestly have not found a thing that will get you out of a crash faster, except to rest and let your lymphatic and blood carry out the inflammation from your body out. The Perrin technique may help a little bit, but it works really slow. So it's kind of hard to give you this and say, expect 2 weeks, you'll get back to your baseline. No, it takes a while. Okay. Someone asked about what's the difference between the Perrin technique and a regular lymphatic massage. So, Perrin technique is directional. It's all going to your heart where the lymphatic drains, or coming down from your head to there. And it also incorporate cranial technique in it to help drain the inflammation from your head. But it is super short and super light, and we often have to adjust that to how sick people are. So some people can be bedbound and we cannot do the whole thing. I tell people that most of my treatment of the Perrin technique lasts no more than 15 minutes. If you go and pay for a lymphatic massage, it is 60 to 90 minutes, and they push really hard. They meant to treat people with lymphedema without chronic fatigue. So they will push really hard to get rid of the fluid. But your inflammation and your waste product are in these fluids. So pushing too hard, too much, your body cannot handle it. So that's why people crash really bad from having a cranial work for 60 minutes or something. So that's the main difference. And we also have a whole set of self-treatment you have to do at home. And we do not want you to just watch those videos and do it, because I will guarantee you that you will crash. So don't do that, okay? All right, next question. Is there any hope in MS medicine helping ME patients? I do not know. I think that right now, everybody is trying to find the magic medication. Long COVID people talk about Paxlovid. People talk about IVIG. People talk about stellate ganglion block. And so there will be some general medications that can help everyone, but I cannot tell you if the MS medication or the rheumatoid arthritis medicine will help people. I have patients who are on hydroxychloroquine. It doesn't do anything with her ME at all. And she tried sulfasalazine, everything. Her ME changed 0. So that's the problem, is that we have to unravel the uniqueness of each patient to figure out what is the right formula for them to get better. Okay, so a question about if perimenopause or menopause can heighten ME symptoms, or can it attribute to an onset of a crash? That is a really good question, because as you know, there are more female than men have MECFS. One of the main reason is that female has these progesterone and estrogen surge every month to have a period. And so majority of my patients tends to be in the early 20s, 30s, when it is the prime time of their life and their reproductive life. Of course, I still have patients who have been sick for a long time into their 50s or 70s, but less so often. the main reason is that men also have estrogen and progesterone, but they are not to that level of fluctuating like what a female does. And I think if any doctors are telling you that they totally understand what your body is doing, that is a lie, because we are finding out that estrogen can be increasing your inflammation in your body, or it can be also anti-inflammatory, depending on which receptor and ratio you have in your body. So that's the problem, is that besides having a period that drains all your blood out, a lot of your blood out and makes you tired, you need to replenish the blood. The estrogen themselves don't just make your female organs produce a period. It does something to your immune system. And testosterone does the same thing too. So I think we are we're just starting to figure out what estrogen actually do, or what some of the other cells in our body that we always thought they only do one thing, and in fact they do many other things. So I often see a lot of my patients who are in the 20s and 30s with ME, they often have heavy period, and that will contribute to their crash or getting more tired. Some people, when they have these hormonal changes, like perimenopause, and they might feel more bloated, they might feel more tired, that can also contribute to it. So it's usually the early stage in the 20s or in the late stage around menopause when your hormones are changing. If your estrogen were anti-inflammatory, function in your body, now you have less, so you have more inflammation type of thing. Okay, so I hope that answers your question. All right, any new biomarkers we have found? So that is a very good question. As I alluded to, that this is a very unique disease. I think Dr. Ron Davis and many other people have been working diligently, very hard to find like a test that is unique to ME. So far I have heard like they see a pattern of your CD4 count, maybe your interleukin-1 or whatever, these immune cells, that they have their own unique pattern if you have long COVID, if you have ME compared to healthy people. Or Ron Davis was doing a test to test for the conductivity of certain fluid in your cell, and they found out that, oh, it is a little bit more resistant to conduct the fluid. However, none of these are specific, meaning that if you have MS, if you have rheumatoid arthritis, we haven't tested those people to see if these unique pattern or unique finding are going to be there. So I'm going to use an example. If you have Hashimoto, there is a unique antibody you can test. It's called thyroid peroxidase antibody, one of them, and that's it. So you can test that. If that is positive, you might have Graves too. So Graves can also have other antibody, but a total of 3 will help us determine if you have Graves or Hashimoto. But these are very specific antibody that your body made to tackle your thyroid. We are not finding a specific antibody that is made to tackle your whole body system. ME is a whole body system. It's not just your thyroid is wrong, not just your joints are wrong, it's your nerves are wrong, it's your heart is wrong, it's your lungs are wrong, your abdomen, everything. So I don't know if we would ever find a biomarker or a set of biomarker that encompasses the whole body system. If that is the case, it will have to be those non-specific immune system pattern. But the question you will have to raise is this pattern really unique to ME, or you see that pattern in other type of inflammatory diseases too? So we'll have to yet find out. So I guess I answer your questions is, will you find something in the next 5, 10 years? I don't know. I hope I'm always wrong, but based on what I see in my patients group in the last 8, 9 years, I don't know if that will happen. Uh, any chance that we will have a cure in our lifetime? We already have a cure. My patients are graduating from ME. I already have 2 people who graduated and are not on medicines for ME. And they don't need to do the Perrin Technique anymore. And so they live a life without pacing. I have heard other people, they do brain retraining exercise, and that got them to remission. So as you can see that it probably is not medication that got you to a cure. I would not call a cure if you are still taking medication every day. Just like diabetes is not a cure if you continue to take medications. So if you are going to stop your medication, you can live a good life, normal life. I call that a cure. So if people have a lot of trauma, maybe certain brain retraining exercise will help. And that might be all you need to help you get your inflammation under control. Others might need to do other things because they have CCI. They might need to address that hypermobility, all those sorts of things. So, yeah, so I hope that answers your question. Most of my patients would have to do a combination of supplement, medications, the Perrin technique, therapy, like mental health type of therapy, brain retraining, hyperbaric oxygen, red light therapy, the vibration plate, some of them do that. Um, some find acupuncture helpful, so they can do that. A combination of all these, okay? And so I cannot tell you what works the best. There is no one thing that works the best. And so it's just everybody has their own treatment. Okay, so I have my last question. Are you seeing any connection between metabolic autoimmunity and MECFS? So there are some anti-CD320 autoantibodies that block the B12 transport in the central nervous system. So I will say that what happened is that when your body is in a very full-fledged hypervigilance and um, very alert and over alert situation, as if your house got robbed by a gang, and now you are holding the gun, patrolling every moment, worrying about someone is coming back. So every little movement will trigger you to say, oh my gosh, there's something wrong. And so a lot of the responses become unnecessary and too much. So a lot of my patients did not have joint pain before they have ME, and they developed this new arthritic pain that were controlled by rheumatoid arthritis type of disease because their body starts to make some new antibody that tackles stuff. But we don't have a test for all the antibodies because we do not know all of them. So I am not surprised that there will be new autoantibodies that were made after you have ME, and that there is a connection between the two because I often see that. The question becomes when you are better off with your ME, would that autoimmunity or those whatever joint pain, Sjogren, those type of things improve, or your thyroid disease improve? I think there is a good chance when the body is more calmed down, diseases you did not have before can probably be gone after that. But some of the disease that you may have might still stick around, but they are just much better control. I think that's all, David. I got those 12 questions. I don't know if your group has other questions to ask.
Yeah, we had a few other questions that were added after we sent you that list, so I can read off a few of
Yeah,
those. Right?
please do.
All right, so the first one is, what's the best way for someone with suspected MECFS to find a knowledgeable doctor or specialist?
Okay, so the question is, how can a person suspecting they have MECFS to find a knowledgeable doctor? So there is no knowledgeable doctors. What you actually want to find is a doctor who believes in you, a compassionate doctor. Most of the doctors, if not all of them, did not learn MECFS in medical school. The newer ones might have heard of COVID and long COVID, so they might be less resistant to believing in you. What I have tried to find is a good doctors that actually uh, believes in you and wanted to help. Those are the doctors we can work with. So we could give them the CDC guideline and say that, hey, this is what I have. Do you believe that I have a thorough workup and I have MECFS? So that will be one thing that I encourage people to do is to seek out doctors who are compassionate rather than knowledgeable. Okay.
You can't have one, at least have the other, huh? Okay.
Yeah.
So then along that line, though, are there any specific directories or networks or clinics that you can recommend?
Yeah, so any kind of ways to find these doctors. So ME Action actually has a search list in their website that talks about who are the ME friendly specialists, I believe all around the world. Unfortunately, those names are self-reported or someone has to report it. They don't go and search. So if no one's report any names, it might not be updated. So that's that's the problem. But that will be the only list I know exists.
Okay. Um, if oh, actually, what role can telemedicine play for people who are housebound or bedbound?
Oh, it will be an enormous role. Our free clinic is mainly telemedicine based. So then that way you guys don't need to go out and that just to dress up or just the fact that you have to get in a car or sit in the office to wait for a doctor takes a lot of energy. I think it's a very, very good thing to have. Unfortunately, the current administration and the system is moving away from reimbursing that. So I urge every one of you to keep pushing your senators, your representative to continue and have push them to say that yes, we need to extend the exception after the pandemic so that insurance can reimburse telemedicine the same way as a regular doctor's visit.
Okay. Um, so we have a question from the group here. Um, they note that graded exercise is dangerous, but
Mhm.
is there any exercise program that helps or at least doesn't hurt?
Yeah, I think there are some very, I think it's called movement with ME. I got in touch with the lady who developed that, and so she has very gentle movement. So first of all, I wouldn't talk about these type of movement until you are on your upswing and getting better, like you have some extra energy that you can spare. And I usually tell people you can start out making snow angel in bed, and so you can actually start moving your arms and legs on the level, on the plane of your bed so you can rest. Just do 1 rep a day or whatever, or whenever you feel. Sometimes rotating your wrists or ankles are good. If you are so inclined, you can lay on your side and you can swing your legs out like that or lift your legs up and down like that or lift your arms up and down. So just very simple exercise like that. Movement with ME has a little bit more specific exercise, but all of these needs to be used based on your energy level and how you are. So I wouldn't do it when you are in a crash. That needs to be preserving energy.
Okay. Um, so how do you differentiate between mental health issues, which I guess 20% of the population has,
Mhm.
seems high, and MECFS? How do you get care if you have both, a small energy envelope and difficulty taking prescription medications?
Yeah, so I think majority of the patient who has both knows the difference. I often ask a question is that if I can give you all the energy you want, would you want to go out and have your Thanksgiving meal with your family? So that is the question is, how can you tell the difference between mental health versus ME? When you have ME, you wish you can go out, but you cannot. When you have depression, you can, but you don't have motivation. So that is the most fundamental difference between the two. So if my patient said, yeah, if I can, I would love to work. Let me ask you, who wants to work in this world? Nobody. Everybody wants to go on vacation. So if you ask them, do you want to go on vacation? Yes. And these people would love to go on vacation, but they just cannot. There's something wrong with them. If you ask people to who do you want to work, who do you like to work? My chronic fatigue patients will all put up their hand and say they want to work. So that's the difference. So I would say that that will be the way I can tell the two apart.
Alrighty. Another question from the group here. How do you, I think it means instill hope in a young adult whose life has been drastically altered by long COVID and MECFS, was in college, and now is able to do so little?
Yes, there is hope. So the question is, a young adult was in college and now they deteriorate and did so little. I was just talking to my patient. She's, I want to say 49 years old. She had mono at age 18 before she started having COVID. We were just talking about she was getting her first full-time job, and I have to tell her how to select a health insurance and put her money in a savings account for her future retirement because she never have gone through this. So it is possible. And so I don't want you guys to lose hope. In fact, I'm more than hopeful that most of my patients should be able to get better. If there's a problem that you cannot get better, it's the problem of the doctor treating you, not you.
Gotcha. Here's a good question for you. Where can people learn more about the Perrin Technique?
Yeah, so on my clinic website, which is my clinic name, MECFS Clinic MN, .org, there is a resource page, a resource tab, and if you click on it, the first thing that comes up from that list is the Perrin Technique. So it has some short videos that I found Dr. Perrin explaining what's going on and why that doing lymphatic work helps. And so you can start out by watching that. They are only 5 minutes long, each of them, and there are some 1 hour long videos for healthcare professionals like therapists or doctors or something like that. So yes, they can look at that. I'm happy to talk to any doctor. Like we on our side, there is a person say that their rheumatologist doesn't know how to treat it. There is a resource on my page called treatment, and under treatment item number 1, I cited the US MECFS Clinician Coalition website. They list out is managed by Dr. Bateman and Dr. Grace at Mayo and whole other people, the top-notch people in the country. And they have listed out how to manage MECFS, how to diagnose it. They talk about all the labs you can ever imagine. None of them are diagnostic, but you can do them like the EBV thing or whatever that the doctor might be interested to do. And then they have another thing that talks about treatment. They are focused more on the medications, the prescription medicine. So the treatment page, which is a Google page, a couple pages long, has the name the medication dose and how it is used on it pages after pages. So there's no excuse. A doctor say they don't know how to treat because the information is available. The question is, a neurologist, a cardiologist, a rheumatologist may not be interested in treating it because this is a cross organ system disease. A rheumatologist are trained to treat joint pain. Now you're telling them that you stand up and now your heart racing and you're dizzy. Well, they will say, I'm sorry, I don't know anything about the heart. You need to go to talk to a cardiologist. So that's the problem, is that the best doctor to treat ME is a primary care doctor that actually knows all these organ system and can pull all these together for you. So there's no excuse if they cannot treat or diagnose. It's all out there. So
Gotcha. All right, this is going back to one of the things you mentioned. The
mm.
question is, what is a vibration plate and what does it do?
Oh yeah. So vibration plate is like you stand on this thing that shakes. And you can Google it and you can see it on internet that you can buy them. And some of my patients use that to kind of shake up their lymphatic that are stagnant and they feel better on it. And so remember I talked about the lymphatic that are not draining properly and your blood vessels are not pulling the blood properly in your head, so you're dizzy. So the vibration plates kind of shake up those lymphatic. The only problem is then they settle down by gravity again. So you can shake all you want, but it is not going to help. So I tell my patients, if you do the plate and shake it up, you need to follow up with some directional, like dry brushing is another way to do it. It's like you directionally pull the fluid to your heart from your extremity. That will be helpful. But you don't want to do it too long or too hard because you can crash. The other thing is that uh, you have to be consistent. ME is a disease of persistency. And so if you cannot be persistent, you won't win. So you have to be like a turtle that you every day work that one step. And so eventually you get to the finish line before the rabbit. That's kind of how, what it counts.
Okay. Um, Next question. Can you recommend what to take for mold toxicity?
So we have a naturopath going to start seeing patients for us for free. He will be a better person to answer in general the supplement. In our Western medicine world, I have treated one or two patients with fluconazole, which is something women take when they have vaginal yeast infection, and it seems to work. Uh, but it needs to be a little longer course, like 14 days or something like that. And that seems to help some of my patients who had these black mold exposure. And you don't need to be on that lifelong. Um, I don't know about what functional medicine doctors do. They will do these detox type of protocol for mold toxicity. And I don't know much about that, so I cannot comment on that. But for regular mold toxicity, if you were exposed to mold, I usually can suggest using fluconazole on my patients. But they need to have normal liver function to take that medication.
Okay. Going back to the Perrin technique, is there a way that a person can do it at home? And if so, what's a safe way to try it out?
So a patient, so the question is, can you do the Perrin technique at home? Yes. So you need to use that technique under the supervision of a therapist who can supervise you, because we have to adjust. It's just like you're cooking a dish. You add a little salt, it's too salty, so you have to remove some salt or add more water. So it needs to have a little adjustment. And yes, a doctor and a partner can learn how to do it. We have training class. Um, all the time. So Dr. Perrin is going to Portland. For those of you in California, he's going to Portland in October. He's going to Chicago in October. He's coming to Minneapolis in March. So there are these classes that people can go and learn. For the training class, I encourage any healthcare professionals to join. Even you are an MD, you don't know anything about this. I tell people that an MD always supervise. So if you send your patient to go to get a PT for their hip pain, the therapist send them back and say, okay, our PT doesn't work. Here you go, doctor. Then your doctor needs to figure out why it didn't work. So if you don't even know what the Perrin technique is, how are you going to help the therapist to be successful? So I said any healthcare provider, professional should learn. It is a little harder for a partner to go to these class because Dr. Perrin will spend 3 days talking about the brain anatomy, and he is going to get you lost. But I have taught partners doing the self-treatment at home on their patients. So that's doable. So yeah, so that will be my suggestion. But I'm happy to talk to anyone who wants to listen, even you are not in the states that I have license to practice in. I am happy to talk to any provider or people to help them get started on anything.
Okay. So why is it hard for doctors to give formal diagnosis for MECFS, or why don't they like to?
Because they are scared. So if if they have not learned it in medical school, they feel like that they aren't quite sure, like as if they need somebody to tell them and reassure them, yes, this is true, this is possible. So that is the problem that most doctors have is number one, they haven't heard of it. They go like, is this real, right? And so you sometimes need another doctors who have done this before and tell them, yes, this is real. They feel like they cannot just read and understand. uh, but the bigger problem is our healthcare system. They work these doctors to death. And so they have no bandwidth for compassion. They have no bandwidth to learn any new things. They go like, oh, when you come in and you said that I'm hurting here, I have all these problems everywhere. Every questions they ask you is a yes question. That becomes very difficult for them to wrap their head around you. So they feel like, oh, this is too much. I don't want to learn about you because they feel like they don't know what to do. So that is the other problem. So I am sad to see that, but you just have to find the right people to care for you.
Um, you mentioned earlier, you mentioned red light therapy.
Mhm.
What have you found about it? Does it help?
Yes. So question about red light therapy, does it help? Yes, my patients have to do them so short and so infrequently that they would help. Because if you put them too close to you or you do it too long, like what they recommend in the protocol for a couple minutes, some of my patients found that it crashed. So I would be very concerned and be very mildly starting to use that. And there are people who do electromagnetic pulse, some kind EM something F or whatever. Those are for the horses to help their joint pain. And that also helps. Some of my patients also found that helpful. So what these things does is they are trying to help regenerate cells and help move some of the lymphatic. And so it's grounding. It can help some people too.
Okay. Um, let's see here. Do you recommend a good book or site on how to get started on gluten-free diet? And is it doable for a low-income family?
Totally. So I don't know if it needs to be very elaborate. I just tell people that you can go ahead and just eat rice and a potato. It's a gluten-free diet, right? So rice, you can you can buy a big bag of it, or potato, you can buy a big bag of it. Those are gluten-free. The only challenge is that you will have to eat tortillas made from corn. You cannot have that very delicious muffin or a pie, but those are not good for you anyway. So, and bread. So now you eat tortillas or other rice cake instead of a muffin or whatever. So totally, it's doable.
Okay. Um, so do you think there's any validity to the hypoxia reperfusion theory of MECFS? If so, does it make sense to try specific supplements prior to exertion to try to reduce hypoxia or to attack the oxidative stress after exertion?
Well, I think that it certainly, the question is about oxidative stress and the low oxygen level, hypoperfusion. Yes, I think that what we believe is that the long COVID people have stickier blood, or that we now understand MECFS that some of the patients have a different shape of the hemoglobin, so they tend to clumps and make blood not as moving very well in your blood vessels and carrying oxygen to it. So it is true. Um, I do not know if taking those supplements will help. Like I said, everything is like so individualized. So you could certainly try it different time during or before, after your exertion, and see if those supplements help. But like anything, if they do not help, please stop, because you want your liver to have bandwidth to clear the inflammation out from your lymphatic and blood. So if you take 20 or 40 drugs and supplements, it's not going to free up any bandwidth for your liver.
Next, what are your thoughts on visible pacer band use during severe MECFS crash?
I think that works. So questions about visible pacing band. I think they worked. I have some patients using Aura Ring right now, and they loved it because after a while they suggest what time you should be going to bed or warn you about emotional stress. I do not have any financial agreement with them anyway. But I have another patient. He has this Apple app on his Apple Watch that does similar things, track your sleep, how much deep sleep and REM sleep you have. I think any of those are helpful as long as it doesn't cost a whole lot of money to you.
Yeah. There's a question out there. Did you mention TNS? If not, what are your thoughts on TNS?
I did not mention TNS, and I do not know what that is.
Yeah, I'm trying to remember what the initials stand for myself.
Vagus, oh, is that the vagal nerve stimulator? Somebody says vagal nerve here. So
Could
I don't
be.
know if
Yeah.
you guys know the TNS. I don't think I mentioned that, but I do have an accent and talk when I talk fast, people don't understand. Or TMS. I don't know what TMS is either. So who oh,
Oh,
transcranial magnetic, whatever. I don't know anything about that. So it's about transcranial magnetic thingy. I do not know anything about that. There might be some ways, or a vagal nerve stimulation. Uh, I have some patients wear a vagal nerve stimulator. They said it might be just a smidge helpful. um, I feel like maybe putting a cold compress on your face, or putting a cold compress behind your head, I mean behind your neck or on your upper spine, help more. That's called cold plunges. And if you Google cold plunges on your heart rate, there are many studies from Mayo or other sites that talked about how cold plunges can slow down your heart rate and increase heart rate variability. And so, especially on a hot day, hot weather, you can do that many times and it's free. So I will tell you that I don't see a whole lot of improvement on my patients using vagal nerve stimulator.
okay. Let's see. I think we missed one up here. Does the Mediterranean diet help?
Depends on the people. So the question is, does Mediterranean diet helps? If you have mast cell activation, it does not. It actually makes it worse because the Mediterranean diet asks you to eat a lot of nuts and avocados. Those are high histamine food. So no. So I will say that in general, I tell people at least try a gluten-free diet to start. Most of my patients have bloating and dairy-free, gluten-free, maybe a low histamine diet for a couple of weeks to see if that helps. One of my patients actually found that he has gluten intolerance. And other people found out that they were allergic to their own water at home, and it has some whatever elements in it, and I cannot remember. And so you might want to figure that out. But a lot of these intolerance, like gluten intolerance, are not positive on any tests. Those tests are positive if you have celiac disease, which means you cannot digest gluten. But in this case, you can digest gluten, but it causes a side effect. And gluten can cause leaky gut, meaning that you can have these undigested food molecule cross your small intestine into the blood and cause more fermentation, so people get more bloated, or that it can make your mast cell worse, your histamine intolerance get worse.
Okay. Well, we are 3 minutes over the hour.
Yeah.
I think we were thinking of holding this down to an hour. I think there's probably more questions out there. So maybe we'll have you back and you can answer a second set later.
Yeah, sure. Well, I don't know. I was hoping to try to answer as many questions as I can. I hope this is helpful to people, and if you have any specific questions, feel free to contact me individually. We can talk. I'm more than happy to help any doctors or any therapist or any family member or whatever to do anything in anywhere in the world. So that will be okay.
That's great. Thank you again for sharing your knowledge with us and continue the great work with your clinic. Appreciate
Yeah,
it.
thank you for tuning in, everyone.
Sure.
So if we have another session, we'll let everybody knows. Okay?
All right. Sounds great. Thanks. Thanks, everybody.
Bye.
Bye-bye.
Take care.